Um, Good evening, everybody. If you can all put yourselves on mute, we'll avoid the distractions, the sound noise. I'm going to introduce our presenter tonight, Leslie Newman and Richard Levine. As you know, are our co-chairs for this study. We did a town hall presentation on January 31st for the greater community. We gave a second presentation for the synagogues last week. Tonight is for our beneficiary and supported agencies. Tomorrow night is specifically for Sussex County information. So those are our upcoming tonight and tomorrow's presentation. I do want to introduce our speaker, who I've had the privilege of working with for well over a year now. Matt Boxer is from Brandeis University's Maurice and Maryland Cohen Center for Modern Jewish Studies. It's the home of the Steinhardt Social Research Institute, and collectively, Braindeis has done more than 25 of these community studies across the country. So I'm going to let Matt take over, do the presentation. Matt, I'll make sure you'll be able to share screen, and Leslie will do the Q&A at the end. And you can use your hand function or chat function when it's time. So Matt, off to you.
Thank you, Seth. With any luck, you should all be able to see some PowerPoint slides now.
You know what? I think it's mostly just like a presentation. So,
okay, and so let me. There we go. I have it set up on my screen as well. First, let me start by saying thank you. It's always a pleasure to join communities for the end of the process of the study, to be able to turn the findings over to you so you can start doing something with them. Seth said this is the third of 4 public presentations of some highlights from the study, each for slightly different constituencies. And so you're not going to see everything from the study today. Indeed, it's only the tip of the iceberg. But I hope that most of you were able to attend one of the prior meetings and you've had a chance to browse through the report, all 118 pages of it, and there are another 220 something pages of technical appendices. Tremendous amount of information there. But if you've started looking through it, you could at least start thinking about how best to use it, which after all is the point of the study. These studies always produce very rich information, much more than what can reasonably be included in a report. So I'm here tonight specifically for beneficiary agencies to focus on some of the key findings for agencies like yours in particular. But as with any presentation from a study like this, we should begin by reviewing some of the overall findings, starting with the size of the community. So we estimated that there were 25,900 Jewish individuals, nearly 26,000 Jews, living in Delaware or the Brandywine Valley, in about 12,600 households. These Jewish households also include about 8,100 people who do not identify as Jewish. They either don't consider themselves Jewish or they're not considered by their parents who are raising them to be Jewish, but they're still part of the Jewish community because they're part of Jewish households and Jewish families. And as I noted in January, the tricky part with those 2,100 kids in particular, and not just them, but also the kids who are being raised Jewish, is that we don't know what decisions they're going to make when they grow up. They might go off to college, meet friends who will drag them along to Shabbat dinner at Hillel or Chabad, sign up for a birthright trip, realize how wonderful it can be to be Jewish, and choose that part of their heritage as a very salient part of their personal identity. Or they might decide they don't really want a whole lot to do with the Jewish community. We don't know which way they're going to go once they have the agency to start making decisions about their identity for themselves. And so it's important that we show them from an early age how wonderful it can be to be part of the Jewish community. And next, a quick review of where these households reside. You can see there's some significant clusters of population in Wilmington, Newark, parts of the Brandywine Valley, and Sussex County. There's a small group of households around Dover, and there's a smattering of dots on the map in between. Each red dot that you see on the map, it might be a little small on your screen, but it's larger in the report. But each dot represents 25 Jewish households, and each dot is placed at random within the zip code where those 25 households reside. It might be a little hard to tell from what you see on the screen, but some of the zip codes are pretty big. So just keep in mind that where the dot is placed does not mean necessarily that the households in question, the households it represents, live in exactly that location. It just means that they're somewhere within that zip code. Now, one important note here, when we conduct a community study, we're typically conducting a study of a single community. That's not to say, for example, that there is a single united, undifferentiated Jewish community in Los Angeles or Chicago or Kansas City or Louisville, to cite a few communities that my team has studied recently. But we're typically studying a community that is focused around a single, relatively small, not Los Angeles notwithstanding, geographic area. Delaware isn't a very big state, but it's still an entire state. And it's clear that there are differences between each of these core regions. How much does the JCC deal with residents of Sussex County or Kent County? What about JFS? How easy is it for you to meet the needs of people who live an hour-and-a-half drive away? And how easy is it for people who live so far away to reach out to you if they need your help? The Jewish community of Delaware isn't one community so much as it's a loose confederation of several small communities. And those of you whose charters call for you to serve the needs of the entire Jewish community of Delaware and the Brandywine Valley, for that matter, don't have a very easy job at all. So in the appendices, we have a bunch of other maps, including this one that aren't in the report. This one shows the distribution of households color-coded by whether or not they're struggling financially. Each red dot represents 25 financially stable households, and each blue dot represents 25 households that are struggling. Now, if this is large enough for you to discern on the screen, it might not be. Again, it's larger in print. But you can see that most of the dots are red, meaning that the vast majority of households are doing just fine, but you can find a few blue dots here and there throughout the map. I'll have more to say on financial struggles in a few minutes, but for now, I'll just note that the Jewish community here looks a lot like the national Jewish community. You're more affluent than your neighbors, primarily because you're better educated than your neighbors. About a third of adults in Delaware have at least a college degree. The proportion is about double that for the Jews. Now, the central analytic framework that we use throughout the report is something that we call the Index of Jewish Engagement, which reflects the predominant patterns of Jewish behavior within your community. This isn't something where you can walk around to people in the community and ask them, what kind of Jew are you? This is based on a complicated mathematical model that assesses 18 specific behaviors, and it assigns our survey respondents to one of these four groups based on the overall pattern of their Jewish behavior. So it's based on what people do and not what they call themselves or the demographic groups to which they belong. And as far as we're concerned, that's what makes it so useful. The labels that people apply to themselves, like denomination, don't necessarily map so neatly anymore onto behavior. And we have all sorts of stereotypes about demographic groups like age, in-married versus intermarried or not married, synagogue members and non-members. And these stereotypes really elide the complexities of Jewish engagement rather than illuminating them. So I'm not going to spend as much time describing these groups today as I did back in January or as we did in the report, but here you see the relative sizes of the 4 engagement groups that we found in your community, ranging from the largest group, the 38% of Jewish adults who are minimally involved in Jewish life, don't really have a whole lot to do with the organized Jewish community, to the 19% who are wholly immersed in it. And here you see the breakdown of the 18 variables that were used to create the index across the 4 engagement groups, broken down into 4 categories: holiday behaviors, ritual behaviors, organization behaviors, and individual behaviors. And you can see I've used a red box to highlight the organization behaviors in particular. Now, there are some slight discrepancies between what you see here and what you see in tables throughout the report where we address these specific variables. The short explanation for that is that in the other tables, what we're reporting is it's essentially the observed behaviors across each of these variables of the people who happen to be in each engagement group. But this table is showing something slightly different. This table is showing a mathematical model that takes into account the totality of the data we collected, and using it shows for each variable included in the model the probability that a member of a particular engagement group has engaged in that particular behavior. It's a very technical difference, but it is a difference nevertheless. So in any event, the red box that I've inserted into this table highlights the differences between the 4 engagement groups on organization behaviors, specifically belonging to a Jewish congregation or another Jewish organization, or an informal Jewish group, participating in Jewish programs, whether ever in the past year or what respondents described as often, and volunteering for or donating to Jewish organizations. So the table shows, for example, that the odds of a member of the minimally involved group participating in Jewish programs often is just 1%. And even that might be inflated because there just weren't enough respondents to completely distinguish between the folks who have absolutely nothing to do with organized Jewish life and the folks who are truly minimally involved, as opposed to not involved at all. And similarly, the folks in the holiday group, they had only a 2% probability of saying that they participated in Jewish programs often, though they at least participated occasionally, largely in programs about Jewish holidays. By contrast, the odds that a member of the immersed group participated in programs often was about 1 in 2. So just for example, if you're representing the Jewish Community Center, you can see how market segmentation might help you use this information to engage with different groups. For the minimally involved group, there isn't a whole lot you can do to reach out to them. You just have to do what you do and hope that if they ever decide to reach out to you, the high quality of your offerings will be attractive to them. And for the immersed group, there isn't much that you have to do. There's already a 99% probability that a randomly selected member of this group is participating in Jewish programs, and a 49% probability that they say they participate often. So for them, you just kind of have to be accessible to them. If they can get to your building, they're going to come to your programs. But what about the 2 groups in the middle, what we've called the holiday group and the personal group? Well, you're already getting them to participate in programs, but they're not necessarily participating in the same programs. And the odds of a member of the personal group participating often are about 1 in 4, whereas for members of the holiday group, they're only about 1 in 50. So how can you get them more active or get them active at all? For the holiday group, everything is about Jewish holidays. So what more can you do around holiday programming? And not only the once a year when a particular holiday pops up. These are the people who are interested in classes where they can learn more about Jewish holidays and maybe life cycle events that can be treated like holidays in some key ways. Give them opportunities to volunteer that are tied to specific holidays, both Jewish and the secular holidays that we celebrate as Americans. Because we have so many of them, that will even give you regular opportunities to engage with them. But to the extent that you're focusing on the secular holidays, do what you can to tie Jewish values to them. Organizations like American Jewish World Service and Repair the World have specific programs for this sort of thing for people of all ages. As for the personal group, they're really more interested in Jewish culture more broadly. And so they're the group that needs things like Jewish book clubs, kosher cooking classes, klezmer concerts, speakers about contemporary Jewish life, things of that nature. So one more practical note on the engagement groups. We don't recommend that you think of them in terms of how to get people to move from one group to the next most engaged group for a couple of reasons. First, really, this is intended to be descriptive. It's a way to assess the ways that people are engaging in Jewish life, not a way to suggest that they should do more. And second, the engagement groups aren't truly hierarchical. They're clearly a low group and a high group, but the two intermediate groups, one is not necessarily more engaged than the other. They're just engaged differently. And third, these are really mathematical constructs. You can't walk around the community asking people which engagement group they belong to and expect them to know. You're more likely to have success using the findings about the groups if you think about the kinds of people who fall into each, figure out what appeals to them, offer more of it, and make sure people know that it's available. People will move between these groups over the course of their lives, but if they're becoming more engaged, it won't be because you tried to move them up some sort of hierarchy. It'll be because you had programs and activities that appeal to them, that got them to want being part of your synagogue or the JCC, or to engage with your school or another organization that you represent, to be a more integral part of their lives and their identities. And if you do what you do well and you offer people what they want and what they need, engagement will take care of itself. So that's engagement. But this group in particular might want to know more about how economic and health factors affect engagement. So where can you find out more about that? Well, there's a lot of it in the report. So let's look at some of the findings that are reported there. And we'll start with income and standard of living. And what you see here is something of a distillation of pages 93 to 97 of the report. Our economic analysis always starts with questions about income and self-perceived standard of living. Now, as I've mentioned, like most American Jewish communities, yours is a relatively affluent community, with only 1% of Jewish households in Delaware or the Brandywine Valley having household incomes below the federal poverty line, and 10% below 250% of it. True poverty is rare, but not non-existent in the Jewish community, and economic vulnerability is pretty common. In the report, we combined the two lowest categories on the standard of living question, those who described their standard of living as being either unable to make ends meet or just managing to do so. And we combined them into a category that we call struggling. This category includes 15% of all Jewish households in Delaware and the Brandywine Valley. Now, you have to remember the timing of the survey. We were in the middle of the pandemic. For some of us, we still are. And it's likely that this number would be a little bit lower in the absence of the pandemic, but not a whole lot lower. We've found that in some of our other research that households that were doing okay before the pandemic tend to be doing okay during it, or even pretty well. It's the folks who were struggling before who are struggling now. And in many cases, they're in even worse condition. Plus, there are a few folks who were sort of at a tipping point before the pandemic who were okay, but they're not now. And what you see here is something of a distillation of pages 98 through 100 of the report. To get a little bit more information about economic challenges, we asked a series of questions about financial hardships and insecurity. And what we found is that in the past year, 8% of Jewish households in Delaware and the Brandywine Valley experienced any of the financial hardships that we asked about, at least one of them, namely paying for healthcare, utility bills, rent or mortgage, or food. And you can see the breakdown on the table on the left side of the screen. Now, it doesn't all add up neatly to 8% because, as you might expect, a fair number of households that struggle with one of these items also struggle with others. For those who didn't experience any of these hardships in the past year, we also asked if they may have experienced them between 1 and 3 years ago, and an additional 5% said they had. So these numbers are probably all slight underestimates because, of course, there's a stigma attached to economic vulnerability. But our experience has been they tend to be reasonably close. They at least give you a good ballpark estimate of the proportion of people in your community who are struggling with hardships like these. Now, in addition to the hardship data, we also found that 2% of Jewish households said that they were unable to pay an emergency $400 expense with cash on hand or on a credit card that they could pay off completely at the end of the month. The bad news there is that it's 2% more than you would like to see. The good news is that nationally, according to the Federal Reserve, as of 2021, 32% of households in the United States could not afford such an expense. And so there's a pretty wide gap between how many households in the Jewish community in Delaware and the Brandywine Valley can't afford this type of expense, and what we see across the nation. And when you think about a $400 emergency, it's really not a lot of money. It's a flat tire. It's a fraction of the cost of a dental emergency. For some people, even with insurance, it's the copay for a visit to the emergency room. This is a true measure of desperation, and it's important to recognize that although most of the Jewish community is not economically desperate, there are some members of the community who are desperate, and they do need some help. And it's also not only about desperation. We were trying to measure desperation, but we tried to measure the full scope of economic challenges that people in your community are facing. About 1 in 7 households are not at all or not too confident that they'll be able to keep their current savings or investments. A similar proportion said that they limited their involvement in Jewish life for financial reasons. A fair number of parents required financial assistance to be able to enroll their children in Jewish schools or send them to Jewish camps and other activities. But another 6% didn't enroll them at all for financial reasons. 7% of synagogue member households needed financial assistance to maintain their memberships, and another 5% discontinued their memberships for financial reasons. 3% of Jewish adults were concerned about affording health care, and 8% of those ages 55 and up were worried about being able to afford to retire or live comfortably through their retirement years. So again, yours is a relatively affluent community, but there's still a fair number of households that are really struggling financially. Now, financial struggles are often related to health issues. And we have quite a bit of data on those as well. In fact, what you see here and on the next slide comes from pages 89 through 93 of the report. In your Jewish community, we estimate that 19% of all households include at least one person who is limited in their work, school, or activities by some sort of health issue, special need, or disability. And in this table, you can also see that we've broken down on the right the proportion of all Jewish households in the community that includes someone with a particular health issue. The middle column is the proportion of all households that include someone with a health issue where that particular issue is the one in question. So as you can see, chronic illness is the limiting health issue in a little over half of all households where someone has an issue, and those households represent 10% of all Jewish households in the community. You can also see that by far the next most common health issues are physical disabilities and mental or emotional health issues, which have skyrocketed across the board during the pandemic. In general, older Jewish adults have significantly higher rates of health issues, special needs, and disabilities, but there are also health issues across the age spectrum. Notably, very few households said they included someone who was suffering from COVID-19 complications. However, 1 in 4 Jewish adults, 25%, said that COVID was a significant barrier to participating in Jewish life. So most people had been able to avoid COVID, or at least the long-term consequences from it, up to and even through much of the wave that washed over us before we started data collection last spring. But it was a pretty big barrier, and it continues to be so and will continue to be so for a while, particularly for people at high risk, because they just the pandemic is not over for all of us, and that's one of the reasons why these presentations have been over Zoom rather than in person. I am one of those high-risk people, and I'm not supposed to be around people any more than I absolutely have to. And here we have a little bit more on health needs and supports from the report. The findings tend to indicate that most members of your community are able to obtain whatever care they need, but a small proportion aren't. And even the folks who are able to get the help they need tend not to have very large support networks. This has also been a huge area of focus during the pandemic for both Jewish and non-Jewish organizations. And every time I see findings like these, I start wondering what communities can do to help foster bigger and stronger support networks for everyone in the community, not only those with acute health needs. So everything on these last 4 slides comes directly from one chapter of the report. But what if you need any of this broken down for a particular group and it's not in the report? Well, some of it is in the report itself, but even more is in the technical appendices. And so if you haven't spent much time looking at those, I want to introduce you to them now. Here we have something that we call the comparison charts. What you see here is the top of the first page of Appendix B from the technical appendices. Now, the comparison charts are intended to be what I think of as a cheat sheet. It's a place where you can look up values for key groups within the community quickly without having to dig through the report or to run analyses yourselves. We don't actually put the charts in the PDF of the appendices. Our experience has been that they're more useful if you have them available as Excel documents. And so if you were to click on the link that's shown in the document, the link that's on the screen here, or copy it into your web browser, you end up on the Cohen Center's website on a page that looks like this. So you can see that we have an image of the cover of the report, a very brief abstract, links to read the report, the executive summary, and the technical appendices, and links to download the comparison charts and the public data set. And I've highlighted the link here to download the comparison charts. There are 12 files there, one for each key subject that was covered in the survey. So let's take a look at one of them and see how it might be useful for you. Now, again, this might be a little bit small on your screen right now, but if you download the Excel files, you can make it as large as you want. What you see here is from, I believe, the 12th file, the one on finances. You can see the rows show for the key variables being analyzed, what proportion of the overall population has a particular characteristic or holds a particular attitude. And we have also broken down the variables by engagement group, geographic region, 3 defined age groups, in-married versus intermarried versus not married, households with and without minor children, and synagogue members and non-members. The columns here represent key variables from the survey. Here specifically what you see is first, the respondent's employment status. Next is someone in the household currently receiving unemployment benefits. Next, how did the respondent describe their household's standard of living using those categories that I showed you a couple of slides ago? Next, how confident are they that they'll be able to afford basic living expenses in the future? And then how confident are they that they'll be able to afford healthcare? If I were to scroll farther to the right within the file, I'm going to find some additional variables on respondents' financial situations. Where you see shading, these are statistically significant differences across the subgroups that are being measured. So, for example, if we see that there are differences in the distribution of employment by region, for instance, Sussex County has the most retirees, and the rest of Newcastle and Kent Counties region has the highest proportion who are working in a single full-time position. And the Newark area has the highest share working in one part-time position, maybe because there are so many students there. And so these differences are statistically significant. Now, you might also look at the difference between, say, synagogue members and non-members and say those differences look pretty significant too. With 32% of synagogue members working full-time in a single position versus 54% of non-members. And on the surface, I would agree, that does look like a pretty big difference. For us to say that an observed difference is statistically significant, we have to be at least 95% certain that observed differences are not simply an artifact of whoever we happen to be able to get to take the survey. In other words, if we did the survey the same way again, we should get the same basic findings over and over again. When we don't have a lot of data to play with, the differences have to be very large to be statistically significant so that we can say we are confident these are real differences and not just an artifact of who we got to do the survey. So where we do see significant differences, where we see apparently significant differences by synagogue membership on employment status, the observed differences just aren't large enough to assert any conclusions. We can't actually say these are real differences between members and non-members. They are suggestive that there might be differences, and it makes sense that there might be. Synagogue members do tend to be a little bit older, which means they're more likely to be retired, less likely to be working full-time jobs. Now, most of the questions in the survey show up as columns in one of the 12 Excel files in the comparison charts. Synagogue members versus non-members is one of the key categories for each analysis in all 12 files. Whether or not there are children in the household is one of the key categories, the ages, the regions, the engagement groups, and the marital status. Those are the other key categories. So if you want to know how those different groups compare across each variable in the survey, this is a very quick and easy reference to use. Now, we like to close community studies surveys with a couple of open-ended questions, one of which is always about respondents' perceptions of the community's strengths and weaknesses. You can see on the screen here, I pulled a few of the quotes from respondents who cited either the JCC, programs of the various agencies, or the agencies themselves as great strengths of the community. And as we wrote in the report, there were an awful lot of people who commented on the close-knit nature of the community and a spirit of collaboration amongst the agencies. It's a tremendous strength to have. But although I only have a few quotes on the screen, I note that in going through all of the quotes that had great things to say about the agencies, it was a lot harder to find respondents from Kent and Sussex counties who sang the praises of this community's agencies. And I think it's clear that that mostly has to do with the fact that being as far away as they have a much harder time accessing your organizations. A family in Rehoboth Beach, for example, might want to send their kids to a Jewish day school or sign them up for a program at the J, but that's not really a tolerable commute, especially when they have to go home too. And it's also clear that there are some significant challenges, largely tied to community size, geography, and expenses. As I've already noted, you are not a single Jewish community. You're more of a loose confederation of at least 5 distinct small communities, with most Jewish communal resources concentrated in one of the 5. That makes it much easier to serve Wilmington than it is to serve Newark, the Brandywine Valley, Dover, or Sussex County. And although you're a relatively affluent community, you have 15% of households in the Jewish community who say they're struggling financially. That makes it difficult for them to afford membership and program fees. It makes it more likely that they'll have health challenges, makes it more likely that they'll need help. But particularly for those outside of Wilmington, it might be challenging for Jewish communal agencies to provide them with assistance. But because you're a relatively affluent community, to the extent that, for example, the JCC is relying on your fitness program to drive revenue, you're also competing with gyms that have been more recently renovated and have more extensive facilities and amenities that put you at a competitive disadvantage. So I see this in lots of communities, and there isn't an easy solution. You want to be open, inclusive, and affordable for everyone, and you also have to pay your bills, and those are sometimes mutually exclusive conditions, unfortunately. So what more can you do that we haven't already said or written? Well, for groups like you folks who are here tonight, one option that I like to focus on in particular is volunteer opportunities. Research on volunteering in the Jewish community suggests that it is a low-cost, low barrier to entry activity that attracts people across religious, social, political, age, and socioeconomic spectra. If you're based in Wilmington and you want or need to extend your reach to other parts of Delaware and the Brandywine Valley, but you can't open a satellite facility, are there people you can partner with? Are there other organizations that you can partner with in those regions to offer more opportunities for volunteering in the Jewish community, or even simply more opportunities for Jews to volunteer in the surrounding community? You'll be able to do some good both for members of the Jewish community in need and for your neighbors, and you'll help Jews meet other Jews and engage in activities that are central to Jewish values, but often go unrecognized as such. And in turn, because more Jews will know other Jews who share some of their interests, you may also lower some of the key barriers of entry to other kinds of Jewish programs, some of the most common of which were not knowing anyone there, or not having anyone to go with, or worrying that you won't be welcome when you show up. So one final note on this slide. If any of this sounds harsh or it sounds like an attack on your work, please don't take it that way. On the whole, our data suggests that you're all doing pretty well, even with the limited resources and the unique challenges that are caused by your community's geographic fragmentation. I am arguably the world's leading scholar on small Jewish communities and how much time and effort goes into creating a robust Jewish community in places where there just aren't all that many Jews. And I don't see anything in any of the data that jumps out at me as an area of real neglect in your community. I can't say that of every community that we've studied. But my team doesn't work as hard as we do for reports to sit on a shelf collecting dust. We want you to hear both from the quantitative data and directly from the words of members of your community where there are unmet needs, because telling you explicitly what is missing is the best way we have to help you start filling in some of the gaps. You have room for improvement. All communities do. And our hope is that you'll use this study to make your community even stronger than it already is. That is the whole point of conducting a community study. So I'm going to end the presentation there. As I noted in January and at the beginning of this presentation, there is a tremendous amount of information in the report and the appendices and the comparison charts. But I hope you found this a useful summary of some of the key findings for agencies. And so with that, I'm going to stop sharing my screen and we can start taking some questions. Thank you.
Thank you, Matt. Couple of comments before we begin. Number one, when we got going with the survey, and try to decide what questions to include. And many of you, certainly the organizations were asked to participate and share what you were looking for. One of the things that we became acutely aware of is that there are certain questions that are well suited to be included in a survey. There are other questions that really require much more conversation. And I hope that each of the organizations will use this as an opportunity to maybe develop some focus groups so that you can dig into some of the areas that are not necessarily, he's very cute, Pam. We have 3 generations of Stape on the phone at the moment. That you will use this as an opportunity to dig into some areas where you want more information that were not easily gleaned from a survey. So that's number one. Number two, I want to reiterate that the data that was developed through this study is public data. It is not something that just rests on the Federation website, not to be shared or used by anybody else. It is public data. And the combination of the recordings of all of the town meetings that we're having, combined with the executive summary, the full report, the data analysis, the data summaries, the charts, all of that is there for you to use in the best way that will make your organization better able to do meaningful strategic planning and make decisions for your future. If you need help with any of this, the Federation is going to be putting together a list of potential resources for both the strategic planning as well as help with the data. I lovingly we talk about these cross tabulations, and Matt gave you a little bit of a hint with that very complex chart that he showed that's in an Excel file. If you need help looking at the data, and I'm almost sure that every organization will need some kind of help, There are resources in our community who are able to do so. They know how to do this data analysis. Robin Carroll Eng is one of them. Danny Haas is another one. Jen Goldstein. There are many people. However, what we're going to be doing is looking for partnerships with the universities in our area, in addition to what Brandeis can do for us to help dig deeper and answer the questions that you may have about the data. So if you want to know, if you were a member of Kutz Senior Living and you wanted to know how many Jewish people there were in Newcastle County and the Brandywine Valley who were 55 and above, who might have the means or not the means to be able to move into your facility, this is the kind of data that we can help provide. And one other comment, because I recognize a few other Sussex County people. Tomorrow night, we are doing this again, but the entire focus of the presentation will be on Sussex County data. So it will be an opportunity to really narrow down the data for just that area, which obviously anybody who has been around for a while knows Sussex County has grown in leaps and bounds, particularly in the Jewish community. Richard.
Yeah, I don't want to cut you off, but one thing I'd like Matt to comment on before we answer any other questions is if he could just say a little bit about how we picked the 1,054 people who were surveyed. I see Alan Evantash out there, and I know that he talked with a friend of mine today, and Alan said he was hoping that we hadn't done all synagogue members. And of course, I wasn't part of that conversation. It got related to me later, and I know that that's not true. I thought it might be useful if Matt explained a little bit about the methodology, because I think that may make people have a better understanding of how this happened and have a little bit more confidence in the results.
Sure, happy to do that. I will warn you at the very beginning of my response, it's very complicated. And what I'm giving you is something of a watered down version of it. But we are conscious of the distinction between synagogue members and non-members, or affiliated versus unaffiliated, where affiliated encompasses any degree of affiliation with the organized Jewish community. And this is intended to be a representative sample survey of the entire Jewish community of Delaware and the Brandywine Valley, which means that it's supposed to stand in for not just the people who are very, very active in Jewish life, but also for the people who happen to be Jewish who could not care less about that aspect of their identities. That group is disproportionately in what we called the minimally involved engagement group, the 38% of Jewish adults in your community who really don't have anything to do with the organized Jewish community. And if we were only focused on synagogue members, we would never be able to get them. So for those who want all of the details of this, it's spelled out in, I believe it's Appendix A, the methodological appendix. But effectively, it starts from a couple of different places. We collect membership and mailing lists from all of the Jewish organizations in the community that were willing to provide them. And we treat that combined list, we combine it and deduplicate it to the best of our ability so that no household appears more than once. We treat that as what we think of conceptually as the known Jewish community. In other words, if you're on one of those lists, you are known to the Jewish community. They might not know you very well, but you're on their radar. And that's a useful way of conducting these studies, or at least starting.
We got you anyway.
Because the vast majority of people in Jewish communities, in most Jewish communities, are on somebody's list. And those of us who work very closely with Jewish organizations, which I imagine is everyone on this call, you know that even death does not remove you from Jewish organizations' lists. So if you've ever been in touch with any Jewish organization, we can find you. Now that gets us the people who are on somebody's radar. We still have to find the people who are completely unaffiliated, who happen to be Jewish, but they're just not engaged in Jewish organizations. They have nothing to do with Jewish organizations in your community. And here there are a couple of tools that we use. There are lots of different ways to do this. What we did in your community, we used a method, the technical name is the Distinctive Jewish Names Method. And this works pretty much as it sounds. There are about 150 last names that are so common in the American Jewish community that between 20 and 25% of all American Jews have one of these last names. They're the Cohens, the Levis, the Steinbergs. They're not the Boxers. You're not going to pick up my family using these names. But you don't have to find all of the people who are completely unaffiliated. You just have to find enough of them and know how many there are. I'll come back to that in a second. Now, the key with these last names is that it turns out there are no statistically significant differences between people who have one of these distinctive Jewish names and people who don't on any of the outcomes that we're trying to measure. There are no differences on synagogue affiliation. There are no differences on connection to Israel. There are no economic differences. There are no attitudinal differences. There are no differences on anything. And so if we know how many people are completely unaffiliated and we can find enough of them, we can mathematically get the people who we got to complete the survey to stand in for everyone who we weren't able to get. So we just have to know how many Jews are there. And for that, we use a project that we call the American Jewish Population Project. The way AJPP works is we take the best done surveys across the entire country, where one of the questions is, what is your religion, if any? And by using some complicated mathematical models, we can use these surveys that typically don't have more than a few Jewish respondents. But if you add up thousands and thousands of surveys, you get enough Jewish respondents, even in some local areas, to estimate how many Jews there are. Now, we are very, very precise on the number of Jews, or I should say adult Jews, who are what Pew calls JBRs, Jews by religion. That is, what is your religion, if any? I'm Jewish. We're a little bit less precise on JNRs, Jews not by religion. These are your atheists or your agnostics who also identify as Jewish by heritage, by descent, by culture, and they make up about 28% of the adult population nationally. So again, using this complicated mathematical model, we can come up with estimates of both of those populations. And then based on who we get in the survey representing those two populations, the JBRs and the JNRs have children, we let the math fall where it may to give us the number of Jewish children in the households. But in essence, the mathematical model tells us before we send out a single survey, roughly how many Jews there are in the local area. And from there, if we can estimate how many Jews were on the lists that we received and look at the difference between those two numbers, we know how many Jews that distinctive Jewish names method needs to be able to represent. And so it's very complicated doing this. I frequently have described this to graduate students as like a jigsaw puzzle with a million pieces that are all roughly the same shape. There's no picture to help you put them together. And there's only one right way to put all of the pieces together correctly, but there are an infinite number of wrong ways. Our job in conducting the community study is to find the one solution where all of the pieces are fitting together correctly. AJPP helps us with that. The survey helps us with that. Some other techniques that we throw in also help. But your population estimate and all of the estimates that come from the survey come from using all of these different sources of information, putting them together, and it results in this 118-page report and 220 something pages of technical details for how we put it all together. But in the end, you get the highly affiliated, you get the unaffiliated, you get everything in between. And it is an accurate mathematical representation of the entire Jewish community of Delaware and the Brandywine Valley.
Thank you. That's I wanted you to, I thought that was important because I had not heard anybody raise that question before. And obviously, if we'd only polled affiliated or synagogue members, we would have gotten a lot of different answers.
Oh, yes.
So thank you.
Okay, for what I'm going to ask, if you put your hand up through either by your hand or in the reactions page, a little thing to put your hand up if you have a question, and we'll open it up. No questions?
The methodology question sometimes takes the winds out of people's sails.
Felicia.
Hi, thank you very much, Matt. I guess because we are, kind of limited for our age group at Cook Senior Living Campus, it's hard for us to, we've been talking about it, it's hard to glean information other than the number of people that are Jewish in the area, and not perhaps what would draw them to Kutz, or what if there were programming, what would that, different programming, would it draw them to Kutz? So I'm wondering if you were able to glean anything from the study as far as it relates to senior living.
So it's a great question. Senior living is a little tricky because, as you noted, it's a somewhat limited population. And the trick with any kind of statistical analysis, it's literally a numbers game. We typically want at least 200 cases available to be able to report any sort of estimate for technical reasons. But really what it comes down to is if you don't have enough cases, and even one of the cases that you have is a poor representative of the segment of the population that you're trying to study, they can completely skew the estimate in ways that result in bad data. An example of this, there was a community that did studies 20 years ago, 10 years ago, roughly. I'm obscuring it a little bit because I don't want to embarrass them. But in the first study, they found that if I recall correctly, 62% of the children of intermarriage were being raised as Jews. And in the second study, they found 20% of the children of intermarriage were being raised as Jews. And the reaction was something horrible must have happened. But the reality is 62 and 20, those look like very different numbers. Mathematically, because both of those analyses were based on very, very few cases, what we call the confidence intervals around the estimates overlapped, which essentially meant that mathematically 62 and 20 were not actually different from each other. And so I know it sounds confusing. It's this is why people have to go to school for years to study statistics, but effectively it meant that those numbers weren't different. The apparent difference was a result of who you happen to be able to get to do the survey. And so that's why we want large numbers of cases for the analysis. And so it's difficult to do any kind of analysis on senior living. However, if you look at the age groups, and we're probably looking at 65 and up, maybe 75 and up, throughout the report, we frequently have both of those age groups, 65 to 74 and 75 plus, broken out. So for example, on my other screen, I'm looking at see what page is this in the report. This is page 61 of the report. We have a table that shows the types of Jewish programs that people attended during the past year, including broken down by age. And we see that 17% of the folks ages 65 to 74 and 16% of the folks ages 75 plus attended programs that were primarily religious in nature, aside from attending services. 22% of the 65 to 74 crowd attended primarily educational programs, and 11% of the 75 plus. 6% of the 65 to 74 and 4% of the 75 plus attended programs that were primarily spiritual in nature. And 9% of the 65 to 74 and 7% of the 75 plus attended programs that were primarily geared towards charitable activities. And so we do have data like that broken out throughout the report. So it gives you some fairly generic, in this case, understanding of what kinds of programs people attend, what kinds of programs they're interested in those age ranges, and that might give you a hint as to what kinds of programming might be most appealing for those age groups. Then there's also the data in the health section in particular, where a lot of that is focused on those older adults. What do they need help with? And to the extent that you have programs that are related to the kinds of things that they need help with, helping them ensure that they have enough for retirement, helping them get resources they need to help with their health needs. Those kinds of things can also be gleaned indirectly from the report. But there's some challenges when we don't have enough data. And unfortunately, this is one of those areas.
I think Matt just gave you an indication of how deeply you can delve into the data and find all kinds of information that we were not able to touch on tonight. And I want to point out, particularly for the folks who from JFS and Einstein, there's a lot of mental health data. There's information on the LGBTQ population. There's a lot of information on the percentage of people in our community who are, as we call them, in-married or intermarried, which I think has lots of implications for programming across the board. Other questions? This is the tip of the iceberg. There is so much data, and the trick is getting help. As I've said at other times, sometimes you have to ask the questions, as Felicia just asked a question. And then once you have a list of questions, we can help you get to see whether there are answers to some of those questions in the report. I want to call your attention to the fact that these studies, and Matt and Seth both referenced that there have been 26 studies around the country, and all of you are parts of networks in your professional areas. So there's, JCC Association, there's a National Jewish and Family Service Organization. It might help if you cross-referenced what communities had a study, particularly those that had a study maybe 4 or 5 years ago. And maybe you can have some conversations with the JCC in Sarasota or Cincinnati or wherever, and ask them how they used the study. What did they do that was helpful? What were their next steps? Our hope for all of you is that you will use this data, and it will help you to develop data-informed strategic plans for your organization, so that you will say, there's more of this or less of that, and I need some of this, and how can I change things? Chaim, your hand is up.
Thank you, Leslie. So my question, and I apologize if it's already been asked, I was just at a religious life meeting for Congregation Beth Shalom. And has there been any thought of how we can use this data together as a Jewish federation rather than individually, to help really sort of market our entire Jewish community to those that may be unaffiliated or perhaps may have talents that we're looking for, whether that be in the area of nursing or social services or education, that there is a way that we could use this information together rather than individually, where then we're all spending limited dollars that we have, but we might be able, again, thinking more collectively, that we could really sort of put these things out to the business, like the business community, to the, synagogue communities, to the, educational institutions, etc. Sort of what we do every year with our Shalom Delaware issue, but really take it another step further, and that is really shalom to the Delaware, but shalom to those that may not be aware of the Jewish community in its entirety.
I'm going to let Seth and Matt answer, but I'm going to say that you raised a really important thing. If a point, I think if you keep trying to communicate with the people you've always communicated with, you've probably gotten the results you're going to get. So the question becomes, how do we get at those we've not been able to reach so far or reached in a meaningful way? Seth and Matt, I don't know which of you want to respond.
Matt, if you want to go first, I'll take a stab after.
Sure. So I have a pretty good guess, I think, of what Seth is going to talk about. So I'll try not to step on your toes on those items. I think the only thing I would want to add to what I anticipate Seth is going to say follows up on what Leslie was just saying. And that has to do with who do you already have and who are you still trying to reach? What a lot of communities struggle with in the aftermath of a study like this is that they have lots of brilliant ideas for new programs, new outreach methods, new marketing plans to get the word out to people in the community. And most of their plans tend to be things that are going to appeal to the folks they already have. There's nothing wrong with that, but if you're looking to reach out to the people you don't already have, that's not going to be effective. There's a reason why they aren't already with you. Typically you're not meeting their needs. You're not giving them what they're interested in. Their needs and interests are somewhat different from the needs and interests of the people who are already entering your buildings, participating in your programs, and sending their kids to you. And so you need to think about not what would I like, what would I be interested in, what would my friends and family and people who are substantially similar to myself want to see from the Jewish community, but what are the needs and interests of people who are completely different from me, who happen to be Jewish? How can I put myself in their shoes and think about what kind of marketing do they need? What kind of programming do they need? What kind of needs do they have that are left unmet? And if you have a hard time putting yourself in their shoes, sometimes the easiest way to start is by talking to the people you do have, the people who are participating in your programs, because they know people who are a lot like them, who are also Jewish, but who aren't participating in your organizations and aren't participating in your programs. And so get them to put you in touch with those people. Find out by talking to them, what is it that you need? What is it that you want? Is there anything that we could do that would make our organization or our program more appealing to you? And so that's often a good place to start, but it's not something that most communities come to instinctively. And so I think it's worth mentioning explicitly like this. Seth?
So one of the things we have already started as a direct outcome of the community study is we formed a strategic planning task force that is about 13 members of the community. And we're going to start reimagining, well, what does the study look like in our community? Two of the things that Matt mentioned really are the big questions. is who are we and who do we want to be? To me, that's visioning as well. And Chaim, you talked about reaching a broader audience. We have to figure out what we're marketing and who we're marketing to. What are the programs and services we're going to offer and how we're going to widen the tent? So there's really two big core questions that have to be addressed before we go out to the market.
Thank you, Matt. Thank you, Seth.
And my guess is that even though each of you has a different book of business, that many of the issues that you struggle with are pretty similar. And people that you want to engage might have more commonalities than differences.
And I think also Matt will concur, some of the issues that we're facing in Delaware, many communities are facing the same thing. All of my colleagues, we're all having a young adult. How do we groom the next generation of leadership? We're all facing that dilemma. It's not a Delaware problem, it's systematic.
No, absolutely. In fact, I've written that as conclusions to many a community study report, that there are new things you need to try for young adults, particularly given that at this point in time, you can go into any gathering of Jewish young adults and you can pitch them on different kinds of programs. The ones that they're going to be interested in tend to be the ones that get at the value proposition of being Jewish. But the ones that the Orthodox Jewish community, the ones that the organized Jewish community is most likely to offer them are the ones that get at survival and continuity. And that's, it's a genuine mismatch in the Jewish community in most places. And so, you want to groom the next generation of leaders. First you got to get them in the door. They're out there. They are doing Jewish things. The popular conception that Jewish young adults are less engaged and less interested in Jewish life than older adults turns out to be empirically wrong. They tend to be as engaged or more engaged than older adults, but they're engaging in other places, and you want to get them to engage with you. But to do that, you have to speak their language a little bit better than most Jewish organizations are these days.
Thank you. Any other comments or questions or thoughts? Well, on behalf of all of us, we'd like to thank you for tuning in tonight. The goal was to give you the tip of the iceberg, to show you just a little bit about what the data can do and what it includes, so that you will have a quest for knowledge of finding out more that will be helpful to your organizations and ultimately to our state of Delaware and the Brandywine Valley. So please, if you need something and you're struggling to get the information out of the report, please connect with, I guess the best way would be the execs to connect through Seth, and we will do everything possible to find you the resource to help you get the most information out of the report. Okay. Thank you, everybody, and have a good holiday, and we should all pray for peace in Israel.